CCT exam preparation. What is the AHAM CCT technical certification? Compliance certification tests the proficiency of staff involved in healthcare compliance and helps to prepare them for the governmental regulations we face today and to prepare for upcoming changes. What are the benefits of obtaining an AHAM CCT certification? Your AHAM CCT certification can be used towards satisfying the Centers for Medicare and Medicaid, the Joint Commission, and Deep North Veritas requirements. The AHAM CCT certification helps keep you in pace with the quickly changing regulatory requirements faced in our industry today. Certification also provides you with industry recognition, personal challenge and satisfaction, national recognition, professional development, individual enrichment, employer awareness, and advancement opportunities. Certification demonstrates your proficiency and a commitment to your profession. Today's webinar will review preparation and tips for CCT certification. The exam overview will cover 3 parts: OIG, fraud and abuse; HIPAA, credit and collection laws; CLIA. The second section will cover civil monetary penalties, EMTALA, CERT, HCQIP, ICD-10, adverse events, and high-tech. And the final overview will review MSP, RAC Recovery Audit Program, Zone Program Integrity, Medicaid Program Integrity, and finally, acronyms. These federal regulations can show up in multiple sections, so remember to study those well. What are some tips and strategy? The CCT exam tests compliance staff proficiency and provides a resource for healthcare managers to ensure staffing competence. The exam includes 80 multiple choice questions. A grading report will appear after you submit your results at the completion of your exam. If a printer is available, you may print your scores. These scores will also be sent to you via email to the email address you provide on your application. You must attain a score of at least 70% in order to successfully pass the exam. The exam study manual is your greatest resource for passing the exam. All of the information on the exam is in the paper exam study manual or the electronic exam study manual. Use the knowledge checks in each section of the guide to understand what types of questions the exam will ask. Use the glossary at the end of the exam study manual for definitions and acronyms. Pay close attention to anything in the exam study manual marked as tip or printed in bold. Other resources include flashcards, online sites to create your own quizzes and review games, study buddies or group. Use caution with online review sites. Existing content has not been reviewed for or approved by AHAM. Final tips and strategies. Utilize the AHAM study manual coaching kits, electronic and paper manuals that are offered by the National AHAM Office, and they are available at aham.org through the certification tab. Now let's talk about recertification. 2 options are available to retain your CCT certification. 1, retake and pass the entire exam every 3 years. 2, join as a national member and earn continuing education units. Be a national member in good standing. You must join as a national member within the calendar year that you become certified. Earn 20 hours of CEUs within 3 calendar years of certification. Let's start with the first overview section that will cover OIG, fraud and abuse, HIPAA, credit and collection laws, and CLIA. Follow along during this presentation using your AHAM paper CCT AHAM manual or the electronic CCT AHAM manual. OIG, what should you know? Identify the 7 elements of an effective compliance program. Identify the benefits of an effective compliance program. And describe the evaluations and certification accreditation process. Also, know and identify the 4 components to the OIG audits. What are the elements of an effective compliance program that you should know? Implementing written policies, designating a compliance officer or contact, conducting comprehensive training and education, developing accessible lines of communications, conducting internal monitoring and auditing, enforcing standards through well-publicized disciplinary guidelines, responding promptly to detected offenses, and undertaking corrective action. What are benefits of an effective compliance plan? Some of those include improves the quality of patient care, initiates immediate and appropriate corrective action, identifies and prevents criminal and unethical conduct, demonstrates the hospital's commitment to be honest and responsible provider, encourages employees to report potential problems. With early detection and reporting, can reduce a hospital's exposure to civil damages and penalties. An effective plan assists hospitals in identifying weaknesses in internal systems and management and helps to fulfill the organization's legal duty to ensure that it is not submitting false or inaccurate claims. The state survey agency verifies the accreditation, removes the hospital from future resurvey schedules, and discontinues any follow-up on deficiencies. If any condition level deficiencies still exist, the state refers the matter to the CMS regional office. Surveyors assess the hospital's compliance with the Medicare conditions of participation for all services, areas, and location in which the provider receives reimbursement for patient care services billed under its provider number. TJC is the Joint Commission. CLIA is the Clinical Laboratory Improvement Amendment that mandates standards that must be met by suppliers and providers who participate in the Medicare and Medicaid program. Know what is the purpose and how is a single provider defined, and be able to define the TJC and CLIA. What are the 4 components to OIG audits? The first, the OAS, which is the Office of Audit Services, conducts financial and performance audits of departmental programs, operations, grantees, and contractors. The OEI, which is the Office of Evaluation and Inspections, conducts national evaluations on significant fraud issues. The Office of Investigations, the OI, conducts and coordinates investigations of fraud and misconduct related to department programs, operations, and beneficiaries. Finally, the Office of Counsel to the Inspector General provides legal advice and representation to the OIG related to Medicare, Medicaid, and other HHS programs. What are fraud and abuse prevention efforts, and what should you know? Be able to define fraud and abuse. Identify individuals who can be considered violators of fraud. List types of contractors that support the efforts to prevent, detect, and investigate fraud and abuse. Identify the 5 laws governing fraud and abuse. And finally, identify the 4 types of fraud alerts. Fraud is defined as willingly and knowingly violating regulations. Examples would include incorrect reporting of diagnosis codes, altering claim forms to obtain higher payment, submitting claim at a higher level of service, using another individual's Medicare card, unbundling or exploding charges, billing non-covered or non-chargeable services, knowingly billing services or supplies not provided. Abuse. Abuse is defined as improperly and often knowingly violating regulations. Examples include billing for a non-covered service, misusing codes on the claim, charging in excess for services or supplies, billing for medically unnecessary services, providing services that do not meet professional recognized standards, and finally, breaches in the assignment of benefits agreement. What are the 5 laws governing fraud and abuse? These bodies of law specify the criminal and/or civil remedies the government can impose upon individuals or entities that commit fraud and abuse in the Medicare program. Violations could include fraud related to Medicare Parts A, B, C, and D, as well as the Medicaid program. Those 5 laws are the Anti-Kickback Statute, the False Claims Act, the Physician Self-Referral Law, also known as the Stark Law, the Social Security Act, and the United States Criminal Code. What are the 4 types of fraud alerts? Fraud alerts are used when there is a need to advise governmental agencies about activities that have resulted in the filing of inappropriate and potentially false Medicare claims. The first fraud alert is the National Non-Restricted Medicare Fraud Alerts, NMFA. There's also Restricted Medicare Fraud Alerts, RMFA. Zone Program Integrity Contractor, ZPIC, or ZMS Central Office Alerts, and finally, waiver alerts. HIPAA, what you need to know. Many areas are covered, including some guaranteed access for small business, 50 or less, renewal of insurance, access for individual who lose their group coverage due to loss of coverage or pre-existing conditions. The HCFAC program is to combat waste, fraud, and abuse in the Medicare and Medicaid programs. Be able to describe the purpose of the Health Insurance Portability and Accountability Act, explain the intent of the HCFAC program, identify the 4 administrative simplification provisions, know the standard transaction formats, describe the purpose of the privacy rule and requirements for a privacy practices notice, and finally, know the differences between administrative, physical, and technical safeguards. The administrative simplification provisions include electronic transaction code sets, privacy requirements, security standards, and national identifier requirements. What are the standard transaction formats? They are the healthcare claim institutional, which is the 837I, the healthcare claim professional, which is the 838P, the healthcare claim dental, 837D, the healthcare claim payment advice, which is the 835, the healthcare eligibility response, which is the 270, 271, the healthcare claim status, which is the 276, 277, the healthcare review and response, 278, and the benefit enrollment and maintenance, 834. And finally, the last standard transaction format is the payroll deduct or payroll premium, which is the 820 format. Credit and collection laws. What are they? The Truth in Lending Act, the Fair Credit Billing Act, the Fair Credit Reporting Act, the Fair Debt Collection Act, and the Telephone Consumer Protection Act of 1991. The Truth in Lending Act, which is also known as Regulation Z, deals with how information is disclosed prior to credit being extended. Under Regulation Z, the APR and finance charges must be clearly and conspicuously identified, as well as written disclosures provided to the consumer. The Fair Credit Billing Act requires creditors to inform debtors of their rights and responsibilities of the creditor, whereas the Fair Credit Reporting Act defines what information from consumer reports can be used by whom and when. The Fair Credit Reporting Act defines what information can be used by whom and when from consumer reports. The Fair Debt Collection Act prohibits harassment, abuse, use of false and misleading statements, establishes timeframes and parameters for when consumers can be contacted. And finally, the Telephone Consumer Protection Act restricts telephone solicitations and the use of automated telephone equipment. The TCPA prohibits the use of autodialers without express consent when the phone number is a cell number. The TCPA also limits the use of artificial or pre-recorded voice messages, SMS messages, and fax machines. CLIA. The CLIA Laboratory Improvement Amendments. Be sure that you are aware of the types of certifications for each of the CLIA, which are valid for 2 years. And they include the Certificate of Waiver, the Certificate for Provider Perform Microscopy Procedures, the Certificate of Registration, the Certificate of Compliance, the Certificate of Accreditation, and the 6 accreditation organizations and the criteria for exemptions. This next section will cover civil monetary penalties, MTALA, CERT, HCQIP, ICD-10, adverse events, and high-tech. Under civil monetary penalties, under the privacy rule violations, civil monetary penalties of $100 per failure may be placed on a covered entity for failure to comply with a privacy rule requirement. That penalty may not exceed $2,500 per year. All criminal sanctions will be enforced by the Department of Justice. Fines range from $50,000 to $250,000 in fines and up to 10 years of imprisonment. Civil monetary penalties for administrative sanctions include the denial of a provider number application, suspension of provider payments, and the application of civil monetary penalties. What are your civil rights protection in healthcare? Title VI of the Civil Rights Act protects persons from discrimination based on their race, color, or national origin in programs that received federal financial assistance, guarantees equal access to health care for Medicare and Medicaid beneficiaries. The Office for Civil Rights, OCR, is responsible for enforcing the HIPAA privacy rule. EMTALA. What is EMTALA? EMTALA is the Emergency Medical Treatment and Active Labor Act, also known as the Federal Anti-Dumping Statute, that requires hospitals with emergency room departments to provide a medical screening examination to any individual. Hospitals with emergency departments are prohibited from refusing to examine or provide treatment to individuals. A hospital that violates one or more anti-dumping provisions is subjected to termination of their provider agreement and or civil fines in the amounts of $25,000 to $50,000, depending upon the bed size. There are also requirements for a transfer that you should be aware of. CERTS, Comprehensive Error Rate Testing Program. The CERT program monitors and calculates the accuracy and error rates for MACs. It also provides requirements and recommendations, review and analysis, and timeframes for which those certification reviews can be conducted. The ICD-10, which is the International Classification of Diseases, Volume 10 code set. It contains nearly 70,000 diagnosis codes and over 70,000 procedures. It groups codes by anatomical site. Each code is between 3 and 7 characters in length. There are two types of ICD-10 code sets. The first one is the ICD-10-CM, which is used to identify the diagnosis codes. The second one is the ICD-10-PCS, which is used to list all inpatient claims to identify procedure codes used in an inpatient setting. What are some of the benefits of an ICD-10? They include measuring the quality, safety, and efficacy, designing payment systems, setting health policy, monitoring resource utilization, and preventing and detecting fraud. Reporting adverse events. Adverse events is defined as unanticipated events such as patient falls, improper administration of pharmaceuticals, and death. There are two types of reporting systems, and they include mandatory and voluntary. Understand the advantages and disadvantages of mandatory reporting systems, such as the MedWatch reporting system that encourages providers to report voluntary serious adverse events as a result of drug reactions. High tech. High tech is the health information Technology for Economic and Clinical Health Act, which contains specific incentives to accelerate the adoption of the electronic health record. Know the goal of high tech, which includes the electronic health record and the electronic health record or the electronic medical record. Understand the purpose and learn the main functions of the EHR and the EMR. This last section will include MSP, the RAC Recovery Audit Program, the Zone Program Integrity, the MIC, the Medicaid Program Integrity, and finally, acronyms. Medicare secondary payer. Medicare secondary payer data is gathered to determine the coordination of benefits. There are circumstances where Medicare is the secondary payer. Those circumstances involve the following: the working aged, which are individuals 65 and older with coverage through a group health plan or GHP, or coverage through employed spouse of any age, or the employer must have at least 20 employees to meet working aged provision. Another circumstance where Medicare is a secondary payer is the individuals under 65 that are disabled and covered under a group health plan with 100 or more employees. ESRD. During the 30-month coordination period, Medicare remains secondary even if beneficiary becomes entitled based on age or disability. Also, Medicare ESRD coverage ends 12 months after no longer requiring maintenance dialysis, 36 months after kidney transplant, or if patient becomes deceased. Other circumstances include workers' compensation, Black Lung Benefits Act, automobile no fault or liability coverage. The Recovery Audit Program, also known as RAC, it was created in January 2010 to identify improper Medicare payments and fight fraud, waste, and abuse in the government program. There are 3 review processes that you should become familiar with: the automated review, the semi-automated review, and the complex review. There are 2 types of RAC denials: the full denial and the partial denial. You will also need to fully understand the appeal process, which includes steps such as the redetermination, the reconsideration, the ALJ, the Appeals Council review, and the final judicial review. The ZPIC, which is the Zone Program Integrity Contractor Benefit Integrity Unit, is used by CMS to identify problem areas, investigate potential fraud, and develop fraud cases for referrals to law enforcement. Understand what each ZPIC is responsible for performing and how the ZPIC work is prioritized. The MIC, which is the Medicaid Integrity Contractors. These are private companies that audit under a contract with CMS. These are generally post-payment audits, often using data mining analysis. There are three that they focus on squarely: focused desk reviews, focused field audits, and comprehensive audits. Know each of those. Finally, at the end of the manual, the electronic manual, and the paper manual is a comprehensive list of compliance acronyms. Have some fun. How many acronyms can you see in this word cloud? It will improve your earning potential, gain recognition and access to the positions and promotions you seek and deserve, build a network of connections in the influential group that shares your designation, continue to expand your skills and expertise through your commitment to continuing education. Good luck on the exam.